Good evening, ladies and gentlemen. My name's Stacy Langley. My colleagues have talked to you about patient rights, literacy, and consent, and I will be talking to you about your responsibilities in your healthcare. First thing is that you have to understand it's a team approach. Your doctor cannot be a part of your team without the patient, and you can't be part of the team without the doctor. So you're a very important, vital part of the healthcare team. Because like I said, without you, there is no team. You have to take an active role in your healthcare. And why do I say that? Is because by having the active role, you are taking ownership of your care and the outcomes you have from that treatment or your doctor, whatever, with your doctor. Also, honesty. You have to be honest with your doctor no matter how embarrassing it is. Because if you're not honest with them and don't tell them everything, they're not going to be able to treat you and get you to where you want to be or should be. Trust me when I say, nothing you say to them can be shocking or shocking to them. They have seen it all over the years. The next two bullet points actually go together, asking questions, and if you don't understand something, ask your doctor to explain it maybe in a different way, because you should never walk out of your doctor's office with questions or not understanding directions on the treatment or how something or what this medication does and the side effects. Ask questions. There is no question that is too dumb. The only dumb question is the one that is not asked. Now that you have some responsibilities besides ones I've just said to your doctor. The first is you want to provide a complete medical history, including all medications that you're currently taking, including over-the-counter drugs, any surgeries you've had, any family history of illness, and any allergies you may have. The reasoning for this is something as simple as you had chickenpox as a child, you have a rash now, and depending on where it is and the look of it and all, you could have shingles because the chickenpox virus stays in your system for years. So it could come back later. You think, oh, I'm just taking aspirin or I'm taking this for this. Medications can have interactions with other medications and stuff, and by not knowing about the over-the-counter, the drugs that you could be taking, you could be setting yourself up to get really ill or something like that. Family history, because some things are hereditary, and without knowing the family history, they might not think to look for that. Now, adhering to the treatment plan that the doctor prescribed and you agreed to follow. And like I said, this includes your medications, taking them when you're supposed to, any treatments and therapies they have prescribed for you, diet modifications, because there's some medications that you can't take with certain foods. Like I know cholesterol medications does not mix well with grapefruits. It blocks something with it, so you need to modify your diet, or like take them at different times, not take it and then eat the grapefruit at the same time and all like that. So there's reasons for that. And also, if you're not following the treatment plans that the doctor prescribed, they won't know if you need to maybe go to a different medication or something else, because if you're not following it, you're not going to see the results that you might be seeing if you did follow them. So it's important to follow them. Also, you want to share with your doctor your health care goals and your religious beliefs. You think your religious beliefs have nothing to do with your health care, but it does, because for example, if you're a Jehovah's Witness, your religion does not allow the use of blood transfusions. Well, if you need a blood transfusion and they don't know you're a Jehovah's Witness, they're going to give that to you instead of trying something else. And if you want to be more active, or you've got something and you want to be more active and you want to be able to do certain things, if you don't share that with your doctor, they ain't going to know how aggressive to treat you for something. And with advanced directives and living wills, you should always give a copy to your doctor, because with your advanced directives and living wills, they provide a roadmap to your doctor. Like, you could have a DNR, which is do not resuscitate order. By having that in writing, your doctor knows if for some reason if you're unable to respond, you suffer a heart attack or whatever, they know not to attempt resuscitation. You could have be in an accident and need to be put on a ventilator. If there's a chance of never waking up and you have an advanced directive stating that if it's going to be a persistent vegetative state, you don't want to be put on a ventilator, they won't put you on a ventilator. So that kind of stuff is very important to give to your copy to your doctors, and not only your doctors but your family members also, so they know these are your wishes, and this is, if something should happen, this is what you want done. Other responsibilities you have. Now, if you're in a big hospital for some reason, and even in a doctor's office, depending on where they're located, your doctor or healthcare facility is going to have residents, medical students, and other trainees, especially if they're a large teaching hospital. I work in a facility that is a teaching facility, and we have residents and medical students and trainees there on a day-to-day basis. By allowing them, if you're comfortable with it, to participate in your healthcare and stuff like that, it gives them the opportunity to learn. And always remember, they're under the direct supervision of a fully licensed doctor, or in case of nursing students, a fully licensed nurse. They're always supervised by somebody that is licensed and overseeing their care, so they're not going to allow that medical student or resident do something that's going to harm you. Also, always let your doctor know of any changes in your healthcare insurances, because you might lose an insurance for some reason or switch insurances and stuff, because that will delay them, will cause a delay in your bill getting paid. Also, if you're having difficulty paying your bills, like after what your insurance pays that you owe, or or even you're having trouble paying for your medications, let your doctor know, because a lot of times some of those medications, they might be able to give you samples, because they're getting them to give out to the patients that need them for some reason, or they might know of a company or a way to get those medications either cheaper than what your copay is, or even sometimes free. But they're not going to know that unless you are willing to tell them and have them tell them that you need that help. They will be more than happy to help you get the financials that you need. Also, you don't think this would be a big thing about maintaining your composure while in the office or a hospital. But there's some people that, I understand you might be getting some devastating news, but you have to keep in your back of your mind at the same time, that there are other patients and other people that are present at that point in time, that you don't want to disrupt everybody in that area, that facility, that office, because you wouldn't want that to happen to you from another patient. So you got to remember, you don't want to do that to another patient. And the last thing is, if you suspect illegal or unethical activities, don't say anything to your doctor, especially if they're the ones doing it. If not, if it's not them, you might want to let them know, but also you want to let the proper authorities know. If it's a doctor, go to the state medical board, and that's for your nurses, or always report it. And it's the worst you can do. That it turns out that you were wrong. That's the least of the problems. Okay, does anybody have any questions? Thank you, and I hope you learned a lot of stuff. And if you have any questions, you can always get in touch with me.